welcome our panel of witnesses. We have with us today Jean-Sébastien Fallu, Associate Professor at the Université de Montreal, appearing online. Masha Krupp, and she's with us in the room. She is a mother who has lost her daughter to methadone overdose and whose son has an addiction to opioids. And from the City of Toronto, Dr. Eileen Davila, the Medical Officer of Health. Thank you all for being with us today. As I expect has been explained to you, you will have up to 5 minutes for your opening statement. Et on va commencer en ligne avec Monsieur.
We will begin online with Mr. Fallu. Before we start, Mr. Chair, I would like to ask the interpreters to speak directly into the microphone. I'm about 9 out of 10 on my volume level, and it's very quiet, so I would like to ask them to perhaps speak more closely to their microphones.
Je pense que ce n'est pas nécessaire pour moi de...
I don't think I need to repeat your comments. I am certain that the interpreters have heard you and will attempt to speak directly into the microphone as you have asked. Mr. Jean-Sébastien Fallu, welcome to the committee. The floor is yours. Thank you. Mr. Chair, Vice Chairs, Members of Parliament, thank you for giving me the opportunity to testify on the study of the opioid epidemic and drug toxicity crisis in Canada, a subject I have been advocating about for 10 years. As an associate professor at the Université de Montréal for 20 years, I am also editor-in-chief for the journal Drogue, Santé et Société, and a full-time researcher at the Centre de recherche en santé publique at the Institut universitaire sur les dépendances and the Recherche et Intervention sur les substances psychoactives Québec. I also founded the Groupe de Recherche et d'Intervention Psychosociale, GRIP, which has been operating in harm reduction in festive environments for almost 30 years. It is well known. I am also someone with lived and ongoing experience with drug use. It would have been nice to be in person with you, but I'm currently in Lisbon for 2 science events, Lisbon Addictions and the International Society of Addiction Journal meeting. Yesterday morning, I presented with Carl Hart, a world-renowned neuropharmacologist who has written several books, including his latest Drug Use for Grown-Ups, Chasing Liberty in the Land of Fear, which is an essential read. The drug overdose crisis, or rather, the drug poisoning crisis, is above all a crisis of public policy and stigma. My testimony will be primarily focused on the stigmatization of people who use drugs, as well as policies and their adverse effects. I will pay particular attention to the importance of an informed discussion and highlight the social determinants of health. The COVID-19 pandemic exacerbated the drug epidemic. The number of deaths has increased from roughly 3,700 in 2019 to more than 7,300 in 2022. Contamination, fentanyl and analogs, nitazenes, and others also play a central role in this escalation. It is crucial to understand that criminalizing and punishing people who use drugs is ineffective, stigmatizing, and aggravates the situation. Despite the complexity of the situation, one thing remains clear. Stigmatizing people who use drugs impedes their access to care and escalates the crisis. We need to refocus our analysis on the root causes of this crisis: contamination in an unregulated market due to prohibition policies, failure to prioritize the social determinants of health, and stigma and social exclusion. Stigma manifests itself in at least 3 forms: self-stigma, social stigma, and structural stigma. It is associated with many harmful effects, including dehumanization, shame, loss of self-esteem, distress, anxiety, depression, social isolation, increased substance use. So everything that we're seeking to counter, basically, decreased request for assistance, and discrimination in access to housing, care, and employment. These effects lead to poverty, a deterioration in mental health, incarceration, and even suicide. In short, stigma kills. Stigma is a social determinant of health. Reducing stigma is an essential goal despite ideological discourse that suggests otherwise. Reducing stigma includes using people-first language that's accurate, balanced, and unbiased, educating the public, and transforming social representations, all with the ultimate goal of transforming laws and policies around drugs. Substance use has always been an integral part of the human and animal experience. Trying to eradicate these behaviors is like opposing the very nature of human beings and animals, or trying to beat air. As a result, prohibition and criminalization not only fail to achieve their goals, but aggravate the situation by exacerbating the crisis. Moreover, our neoliberal policies contribute to misery and poverty. Prohibition policies create a toxic market that escalates the crisis, the prohibition paradox. We are far from prioritizing social determinants of health. In the face of this misery, toxic markets, and the failure to prioritize social determinants, we insist on stigmatizing, excluding, and blaming individuals, which only exacerbates the problem. For decades, our approach to substances has been stigmatizing and disconnected from reality. Rather than asking why, we continue to use the same approach and hope we'll achieve different results. Some people say that decriminalization in Oregon or BC was a failure, but that's not the case. Decriminalization is only a small part of the solution. It does not solve problems of poverty, access to housing, healthcare, social services, treatment, or access to decent jobs. In terms of solutions, several insufficient and irrelevant proposals are often put forward. However, I can see that the majority of recommendations are in line with mine, which includes rethinking drug policies in favor of an approach that is geared toward public health and human rights, promoting harm reduction services as well as access to healthcare and social services for people who use drugs, investing in all social determinants of health, including access to care and stigma reduction, decriminalizing, regulating, and legalizing drugs, implementing harm reduction policies, and finally, developing more services and decentralizing them. Thank you for your attention. I am available to answer your questions. Thank you, Dr. Fallu.
Ms. Krupp, welcome to the committee. Thank you for being with us. You have the floor.
Thank you. I want to thank you all for inviting me to speak today, for giving me the opportunity to share my lived experience with the methadone treatment and safe supply programs. I'm going to touch very lightly on one issue. My daughter, Larissa, she died in September 2020 from methadone toxicity, 12 days into her methadone treatment. I wanted to bring this to the forefront, too, because there's other ways of dying. This was at the hands of a doctor at Recovery Care here in Ottawa who did not conduct an opiate tolerance test on her prior to starting her on the methadone program, and unfortunately, 12 days into her program, she overdosed because of the dose that the doctor gave her 2 days prior. So I think it's important to know that methadone is a great tool to get a person on the path to recovery, but we also have to look at how it's dispensed and prescribed, and that the doctors prescribing this know what they're doing and not skipping any steps. But what I really want to talk about today and focus on is the protracted and lived negative experience with my son, who is in active addiction, and he's been under Dr. Charles Bro's care at the Byward Market Recovery Care location on Rideau Street since June 21, and on Safe Supply under Dr. Bro's care since the fall of 2022. He's prescribed 28 hydromorphine pills daily, in addition to his current dose of 45 milligrams of methadone. He was on methadone last year as high as 165 milligrams. He's still using street drugs. 3 years later, my son is still using fentanyl, crack cocaine, methadone, despite being with Dr. Bro and with recovery care for over 3 years. As soon as he was put on safe supply, he started diverting his safe supply, as most of the patients that I see coming out of this clinic on Rideau Street, I see them in front of me, coming out of Dr. Bro's office, coming out of the pharmacy, right in front of where I'm parked. I've taken pictures. They're counting out these white pills. There's a dealer's sort of come out of nowhere, and they hand them a little thing wrapped in plastic. I see them move a couple of feet, and they're smoking and injecting right on the street. This is my experience with Safe Supply, my experience with my son. I have gone in to see Dr. Bro myself personally, as is his father, over the last 2.5 years, asking for a treatment plan, asking for counseling, letting the doctor know that he's using fentanyl, that he's using crack cocaine. We're worried about overdosing. The doctor really didn't respond to anything. His answer to me was, my son is the one that has to ask for the treatment plan, not me. So the last couple of years, I have essentially been monitoring my son. I moved in with him. In fact, 3 or 4 weeks ago, I had to call 911 because he overdosed. This is all under the care of Dr. Bro, recovery care clinics. We're into it 3+ years. Why am I still calling first responders when these clinics, is my understanding, under SUOP, are receiving millions of dollars in funding, 10+ million to date. Their websites purport to have a treatment plan individualized for each patient, mental health counseling for each patient. They have one mental health counselor, to my knowledge, across 4 clinics, who only is available virtually more often than not. I'm not looking at my notes anymore, but essentially, as a lived experience, and as somebody who has observed what is going on outside of the recovery care clinic on Rideau Street for the last 3 years, the diversion I'm witnessing, not just my son, but the people outside the clinic, this is not working. I feel that Safe Supply has its place and can be helpful, but the dosage has to be witnessed. You can't give addicts 28 pills and say, well, here you go. They sell for $3 a pop on the streets. You've got drug dealers, I know this for a fact, through my son. I've seen it. They come to your home 24/7. You can call at 2 in the morning. They take your hydromorphine pills. They supply the crack, or the fentanyl's now down to $60 a gram. Used to be 120, 170. So addicts are like my son, who still wants to get clean, through the type of care that he's receiving at recovery care specifically, because that's my lived experience. Dr. Bro, in my opinion, knows what's going on, because I told him that I suspect my son is diverting. I want to know why he's getting so many pills. Where's the treatment plan? Where's the mental health counseling? I need to save his life. 3 years in, I should not be calling 911. They're already overextended. In closing, what I want to say is, I see no evidence of all this SUOP funding, which is taxpayers' dollars, yours and mine. I see no evidence of it being spent on treatment and recovery at recovery care for their patients. I believe that we have to move away from what is a harmful drug legislation model to a hopeful recovery-focused model, where you've got detox treatment, you've got mental health treatment, you've got assistance in acquiring housing, employment skills. I believe that Safe Supply can only work if it's witnessed and dispensed, and there's a treatment plan attached to it. As I said, I've been trying to keep my son alive for the last 3 years. He's been in this Safe Supply program. I have spent hours, weeks, months, his father and I, we've been looking for a treatment program. We've been looking for something that's based on recovery. And at this point, what we see is all roads point to the Alberta model. Thank you.